It just feels like everything inside of you is just crumbling.
Your heart starts racing, your chest feels tight, maybe it even hurts, and you feel like you can't breathe on top of everything else. We look at the physical effects of anxiety and talk with experts about how to try to stop that panic attack in the moment. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. Around 1 in 5 adults live with an anxiety disorder. That means we all know someone who's experiencing this common mental health concern. Maybe it's you. We dive into the options on how to treat anxiety and give you the best advice from the doctors on how to calm a panic attack as it happens. But first, let's get to today's morning rounds. And for this, we welcome the Olathe Fire Department Chief joining us from our studio on the Olathe campus. Let's welcome Fire Captain. Oh, Captain, I made you Chief. Hope the Chief isn't watching. I like my version better. Thank you, Captain Hall. So you're here to talk about a great event the fire department is hosting called the Helmet Head Bike Rodeo on Sunday, May 3rd. Kids ages 15 and younger can get a free bike helmet while supplies last. So Chief Hall, I want to start out by asking you, what exactly can people and parents expect when they arrive at the event?
Well, hopefully we're going to have great weather. We've had a little questionable weather on these last weekends, but when they get there, just a lot of family fun. Free hot dogs while supplies last, going to be cooked up by Atmos Energy. Get some free bike helmets while supplies last, and they're going to be properly fitted, which is even better. You can get a bicycle safety inspection, ride the bicycle safety course and practice some of your skills, and then get some health screenings and even enjoy the Family Fun Fest.
That's so nice. I don't remember this being an option when I was a kid. I just got a bike and rode off. No helmet or anything, which gives me the willies now, but that's what it was like in the 70s. You brought a helmet with you, so we want to show that and talk about how important it is to make sure you have the right size helmet. How do you know if it fits correctly?
Okay, so we want to make sure that the circumference of your head matches the helmet that you get. In this case, all of ours are ratchet style. We got 3 different sizes. We kind of firefighter proofed it by color, so that way it's easy for us to grab one. We got a medium here. And we just want to make sure the circumference works in here, that fits nice and snug, and that it also sets nice and level on the head. A lot of times, you'll see somebody riding around, and they got it all rocked back and exposing the forehead.
Right.
Well, we want it nice and level on the head. We want the V-straps just below and in front of your ears. We want to be able to put 1 to 2 fingers under that strap. And then we just want to make sure that when you're on anything wheeled, that you're wearing a helmet.
During the event, the health system's also going to be providing some free health screenings. Why was this partnership important to you to have with the health system?
Oh, because we both really have the common goals. We want a safe and healthy community. And this partnership, believe it or not, is now, well, 2006 was the first ever bike rodeo. And you were one of our first partners.
And we all hope that everyone who shows up at this event is never a patient here because of some sort of emergency, which happens when there are crashes. Let's talk about crashes involving electric scooters and bikes, because we all know they can have devastating consequences, especially when the rider isn't wearing a helmet. Some of the patients treated here at the health system are very young. We've seen patients as young as 8 years old that were hurt on scooters just this year. So as a first responder, what kinds of injuries are most common?
Well, over the years, we've seen everything from bumps to bruises to breaks to the absolute worst. So we just want to make sure, protect that head when you're on anything that has wheels, whether it be old school rollerblades, a scooter, now the e-bikes are much more popular, or even just your bicycle.
In addition to obviously wearing a helmet, what's one rule or habit that you wish every parent or kid would follow before heading out to the ride?
Just make sure that you got your helmet, it's in great shape. And then also remember that if you ever have a helmet that takes an impact, it's like a car seat. Once a helmet takes an impact, go get a new one, get a replacement, and just have that helmet always at the ready. Okay,
so one crash with a helmet where you hit your head, get a new one.
Absolutely. Once the helmet takes an impact, replace it, get you a new one.
I didn't know that. That's great information. Thank you so much. Again, the event will be held this Sunday from 11 to 2 in the parking lot of the Cancer Center at the University of Kansas Health System Olathe campus. Thank you so much for joining us this morning.
Thank you.
Now to today's topic on our show, anxiety. Anxiety is one of the most common mental health challenges in the United States. Listen to this, more than 40 million adults suffer from anxiety. That's almost 19% of the population. And even though this is highly treatable, statistics show only 1 out of 4 people who have it seek out help. So what can you do when you're in the moment? For this, we bring in our incredible panel. We have psychologist Dr. Jessica Hamilton. Thank you for being here. We also have psychologist Dr. Kelsey Sewell. Thank you so much for joining us. And psychiatrist Dr. Laura Heckert. Thank you so much. Glad to have this panel assembled. So Dr. Hamilton, I want to start with you. What exactly is happening in the brain and the body during a clinical panic attack?
Well, it's very physical. So I think most people have heard of the fight or flight system. And that's actually related to a biological thing going on in the body, sending an alarm to us saying something might be wrong. And that's related to the HPA axis, which is just like a really easy, fun little term, but it's related to your hypothalamus, pituitary, and adrenal gland all activating at the same time and sending out hormones, which eventually get related to cortisol, which is that stress hormone that we've talked about in the past.
Right.
And that hormone that's being released can then create those physical symptoms and send, if you've ever been almost in a car accident, the butterflies in your belly, right? Or the heart palpitations or the sweaty palms. If you're going in for a test at school, that's also those symptoms that you sometimes get. And so they can vary.
Afterwards, it almost feels like a hangover.
Well, you have that adrenaline rush and then the dump. And so you can have those feelings of fatigue that last quite a while afterwards, depending on the symptoms of panic that you experience. So there can be mild panic attacks all the way to pretty severe panic attacks where people really are feeling like they are about to die, that sense of doom where they are hyperventilating and they can't catch their breath. Sometimes people talk about vomiting, getting very lightheaded, or feeling like they may pass out at any moment. And so kind of recognizing that while that alarm system is going off, we want to learn how to recognize that it is not life-threatening. We want to make sure we're ruling out any medical conditions that might be present, but that panic isn't life-threatening, and we want to learn how to manage those symptoms as we go.
When it comes to what triggers them, Dr. Heckert, what are the most common triggers for a panic attack?
So a lot of panic attacks are triggered. They can be provoked by really anything. It varies from person to person. It could be something
like a stressor.
It could be something like being in an argument or a conflict, or being in a crowd, or some reminder of a previous bad experience. That can be very triggering.
Why is it that they can also happen to someone without any warning, with no obvious emotional trigger?
Yeah, so some panic attacks seem to just come out of the blue.
Right.
But what's happening is that the amygdala, the brain's alarm system, is picking up on some slight abnormal bodily signal, and it detects it as a threat, and it kind of overreacts. It could be something as small as like a skipped heartbeat or a dip in blood sugar that you wouldn't otherwise notice.
So something that you're not consciously seeing in your environment that would make you nervous.
Exactly. And chronic stress can make the amygdala, that alarm system, hypersensitive. So even the tiniest little abnormalities can trigger those panic attacks.
That's so cruel, because you try to be in control of things, and then it turns out your body can trick you and sense some sort of like faux alarm and send you into tailspin. Dr. Sewell, in the moment of a panic attack, what are the fastest, most effective ways, if someone's able to compose themselves, that they could try to bring themselves out of that?
Yeah, it's a good question. Most of our most effective strategies interrupt the panic attack, almost like cutting off fuel to a fire. So a couple of my favorite ones, and really quick, I'll just say I don't usually suggest deep breathing as the first one for people, even though that's such a commonly talked about thing. And that's because unless you're really good at deep breathing already in your day-to-day life, changing the flow of like oxygen to carbon dioxide in the middle of a panic attack can make your brain panic more, right? So a lot of early new therapists accidentally trigger panic attacks in their patients and learn a valuable lesson not to maybe start there. So the ones that I usually recommend, the first one is a longer kind of interesting fun story that you could look up, but it's called activating the mammalian diving reflex.
Look up?
Yeah, I said people could look it up. Like,
look it up.
Yes,
I was thinking
yes.
look up.
We want to activate something called the mammalian diving reflex.
Okay.
And what that is when your face is coming into contact with cold and you're holding your breath at the same time, your body is designed to think, oh no, what if we're diving into deeper water? We're getting further from the surface. We need to be able to conserve energy so that we can get back to breath. And so the body starts conserving energy. And so if we can activate that, then we cut off flow from the panic attack, because the brain is not going to waste that energy on a panic attack when it thinks it needs to breathe.
What does that look like?
Yeah, it's a really interesting one. So you could stick your face in ice water and hold your breath.
Right.
Not necessary though. If you get ice packs and you make sure you're covering eyebrows to cheekbones, at the same time you are holding your breath for at least 20 seconds, then that kicks on that reflex and you can just watch the panic attack start coming down.
That's so
That's a
interesting.
really good one. In public, an easy one to use too, there's a lot of different ones called grounding, but the idea is that you are getting the brain to focus on the senses enough that it pulls away from fueling that panic attack. And so one I like to talk about is the 5 senses grounding. So you have people find 5 things they can see, 4 things that they can touch, 3 things they can hear, 2 things they can smell, 1 thing they can taste, and the goal is to describe it so well that they could tell somebody who's not there what those senses were like, and that really pulls the brain to have to focus. So I tell them, take a really flavorful, good-smelling mints with you or something so you have that available, and then otherwise use your environment, and that can just cut it right off.
That's super interesting. With the one you described with the ice packs, if someone doesn't, could someone just open a freezer and just put their face in there for a blast of cold air for 20 seconds, or is that not
Really
cold
good question.
enough?
It may work.
Yeah.
They've actually studied though, some people just naturally are like putting ice packs in the back of their neck, or they're putting their hands under cold water, and all of that might work, but the research has really looked at where it sends the most direct messages for this
Yeah.
reflex, and it really is this rectangle right here, and making sure it gets
so
really
interesting.
cold. Yeah.
So Dr. Hamilton, for people who are suffering frequent panic attacks, what long-term treatments have you found that work?
Several different ones can be pretty effective. I mean, in the moment, Dr. Sewell's examples are great. There's also like this idea that you want to start learning when your body is getting false alarms. So that when the amygdala is activated at times that it doesn't need to be, and learning those early signs of anxiety so that you can start to manage them a little bit more effectively, in hopes that you don't end up getting into a place where you're having a full panic attack.
Like people would recognize little tells that they might not recognize with the first one.
Yeah, or like, oh, my first symptom might tend to be my palms are getting sweaty, or oh, I'm having heart palpitations, and immediately going into some skills that they might learn from. So that could be things like using cognitive behavioral therapy and challenging the thoughts associated with, you know, I am safe right now. There isn't any immediate danger going on. Let me kind of challenge this physical feeling that I'm having with my environment. And you can even at that point in time use the 5 senses or a grounding technique as well. There's also a therapy called interoceptive therapy, which is kind of like an exposure response prevention technique specifically for panic symptoms, where you actually, and do not do this alone, recommend doing this with a therapist.
Okay.
But you bring on and learn to bring on symptoms of panic to retrain your brain to learn that that doesn't have to be something that's scary and or that has to bring on a full panic attack. So it's learning to be uncomfortable and recognize that isn't a danger.
What would that look like in a therapist's office?
So that can be things like intentionally hyperventilating. So you can breathe through a straw for a short period of time, like 1 to 2 minutes, and that might bring on that sensation of hyperventilation. You can spin in a chair for 30 seconds. You can put your head in between your legs and have the blood rush to your head. There's lots of different strategies that are used in kind of like an intake to kind of identify what those symptoms of panic might look like for you. And then again, learn to be comfortable with the uncomfortable and knowing that that doesn't necessarily mean that the whole panic attack needs to occur, that you know what this is.
You can have one little thing.
You can
and it
have
doesn't
one
to
symptom and
spiral.
it doesn't have to spiral.
I'm glad I asked that because I was thinking you were going to say if someone's has a dog phobia, you'd bring in a dog to try to desensitize them to that panic, but is that a completely different kind of therapy?
It's the same type of therapy, actually. It's coming from that exposure place, right? But you don't necessarily bring the dog in right away.
Okay.
Right?
Okay.
You might start with a picture or an image and describing those things.
Okay.
So it's a slow desensitization versus just a flooding approach.
Dr. Heckert, there are different kinds of panic attacks. How many different kinds of panic attacks are there, and can you walk us through the different types?
Well, I think panic attacks can be a little bit different for every individual. But the common symptoms are that intense feeling of fear and the physical symptoms that go along with it. It's also very common for people to feel like they're going to die or like they're losing control or going crazy.
Right.
And like we said before, sometimes those can be provoked by specific things, and other times they seem to just come out of the blue.
What would be the biggest mistake, Dr. Sewell, that people make when they're trying to stave off a panic attack that they feel like is coming?
I mean, I think that what I mentioned earlier, just trying to take deep breaths, sometimes actually can accidentally be, the biggest mistake. But I also think that, panicking about the panic coming tends to just fuel it that much faster, right? I think the best way to counter that is to try to remember and have family maybe remind you that these end. These are temporary. The big thing about panic attacks is they end, and sometimes that's how we tell if there's another medical emergency going on or if it's a panic attack. And reminding yourself that this is just temporary and I can get through it really does help.
Such an unfair problem to have, because someone's having a panic attack or they feel like it could come at any point, and then they're starting to panic about possibly panicking. It feels like it'd be like a dog chasing its tail. We actually have touched on this a little bit during this discussion, where it's not uncommon for someone suffering from a panic attack to feel like they're dying. And there are instances of people calling 911 thinking they're having a heart attack. That actually happened to a very good friend of mine. So the question is, how do you know the difference when you're in the moment between the two? We talked with emergency medicine specialist, Dr. Brian Beaver.
The first thing we want to do is make sure you're not having a life-threatening emergency. We're going to check your vital signs. We may do something like an EKG to look at your heart rhythm to make sure that it's beating appropriately. We're going to sort through all those possible emergencies before we just blame it on a panic attack.
We already have some great questions and some comments coming in. So if you have a question or a comment that you'd like us to read out loud in the program, you can send it to us right now on YouTube or Facebook. You'll find the links right here on your screen. So we've heard from our panel of doctors on the science behind panic attacks. But what about people who live with these conditions? We asked our roving reporter Yumi Stroder to hit the streets and talk to people about this issue.
It's like a dam that's busted wide open, and all of those emotions just come flooding.
Mine started back right before I got out of the military. Felt like I was having a heart attack, and so they got progressively worse after I got out, and went to the hospital, went to the ER one day because I was like, what's going on? It felt like I was dying, and turns out it was panic, or a panic attack.
I get really bad lockjaw. My jaw will start to shake, and that is the first indication that I know that I'm getting sent into an anxiety attack or a panic attack.
I lose spatial awareness, I cold sweats, hot sweats.
Mine can last up to 2 to 3 hours depending on the severity of what triggers it. But internally, it feels like my heart has dropped down to my tummy. It physically feels like my heart is breaking. That is the best way to describe it, is it just feels like everything inside of you is just crumbling.
There's no real rhyme or reason to them. I feel like I understand them better, so I can work my way through them a little bit easier, but when they really come on strong, there's really nothing you can do except ride it out.
Walking does wonders. People they underestimate the power of just movement when you're in, when you have these, and you pair it with a great song and everything. It's magical.
I take a shower. Sometimes I will just kind of meditate, for lack of a better word, and really focus on the breathing. Sometimes I'll go out for a walk. Sometimes they're just so overwhelming you can't really do anything about it, so you just have to kind of sit down and push yourself through it.
First of all, that's so honest. Are you surprised that we were able to find 2 random people to share their journey? I was, because people didn't talk about this just 10, 20 years ago. Did it resonate with you how they described those panic attacks?
Absolutely. They both described really physical symptoms, and it sounds like they've both gained a lot of insight into what their panic attacks are like, so they can they've come to be able to kind of predict the panic attacks when they feel those early symptoms.
And a huge thank you to the people that we interviewed. Those weren't interviews that were set up ahead of time. These were just 2 random people that Yumi stopped on the street, and they were so open, which really helps shed a light on this issue because it's a big problem. We've talked about how only 1 in 4 people who have an anxiety disorder seek treatment for it. So Dr. Hamilton, why do you think that number is so low?
You know, I think historically speaking, there's been a lot of stigma around mental health, and so I think that is probably a contributing factor. I do think that that's kind of evolving. You know, I think it's becoming more commonplace to see mental health as part of your team in healthcare, which I think is fantastic. I also feel like sometimes people might be experiencing anxiety and they don't want to acknowledge it, right, themselves. They like that because it feels like they're losing control. And identifying, you know, resources is a challenge, the barriers to getting into services, but also like, do you want to acknowledge that that exists, or is it creating a big enough impact on your life that you want to seek out help?
And once you name it, you're saying, I have this problem. For a lot of people, I think talking about something that your brain is just another part of your body, but it's much easier for people to talk about a sore ankle than it is for them to talk about something in their brain affecting them. Dr. Heckert, when it comes to medications, what are the differences between daily medications that are prescribed versus as needed? Or Dr. Sewell, I'm sorry.
Nope, it is Dr. Heckert.
Oh, it's Dr. Heckert. Okay.
It is her.
All right. Threw you for a curveball there. So what's the difference between daily medications that are prescribed versus take as needed medications?
Sure. So a daily medication is just that one that you would take every day with the hopes of preventing panic attacks, or at least reducing the frequency and the severity.
And what kinds of meds would those be?
Yeah, so the medications that we usually call antidepressants are actually used for a variety of things, one of them being panic disorder. So those medications work on serotonin receptors in the brain, and they can help to reduce the panic attacks.
Okay, and then the as needed that you take in the moment, what are those?
So as needed medications are really those that are fast acting, that can calm the mind and the body in the moment. So benzodiazepines are a common type of medication used in this manner, and they just really calm down both the mental processes and the physical sensations. They can be very effective, but unfortunately you can develop tolerance to them, and they can lose effectiveness over time. So if somebody is having frequent panic attacks where they're needing to use those as needed medicines often, then we would recommend a daily medication for prevention.
When it comes to exposure and response prevention therapy, Dr. Sewell, what does that look like?
Yeah, so the goal there is to kind of recalibrate that threat detection system. So it's kind of like saying, yes, if you got into like a sword fight and you got wounded, that would be extremely dangerous.
Right.
And a needle for a blood draw at the doctor's office is not the same level of danger, right? And you don't get benefit from your brain treating it that way. So you have to figure out how to get your brain to no longer ramp that same level. And so what we do is we set up a kind of ordered level of that fear from something that doesn't feel scary to something that feels extremely scary, and we very gradually work our way through exposing the person to it until each level is not scary anymore before we go to the next one.
What would that look like with what you just described, someone who gets panic attacks from a needle?
Yes, yeah, so what we would do usually is start with something that feels very manageable, like looking at pictures or just imagining getting a blood draw, maybe watching a video of it. We see where those things land kind of lower. Then we might walk by one. We might go visit a lab. We may set up, I've had people who will do like the diabetic finger pricks for a bit because that feels easier than like an IV. And eventually we go to the lab and we get an IV so that we can, or we get blood draws so that we can actually experience that until, working our way up until they can do everything in day-to-day life that actually impacts them without it causing that anxiety. And it works very well.
I want to go to some of the questions from our community and some of the comments that are coming in because we have them. Jeremy Yenser, one of our viewers, wants to know, for people who experience panic attacks, can the anxiety about a possible next panic attack actually trigger a panic attack? Who wants to take that one?
You want to take it? Sure.
Can anxiety over a panic attack trigger a panic attack?
It can, yeah.
Yeah, that's so rude.
It's
rude.
So rude.
Not fair.
But it's because your amygdala and your HPA axis gets so activated in fear of what could happen, and it's kind of, again, learning that you have to stay in that present moment of like, okay, is there anything currently happening that is telling me that I'm about to have a panic attack, and then training or recalibrating, I like that word, the brain to recognize that there's no danger going on right now. I sometimes talk about alarm systems, like fire alarm systems too. It's like we need to change the battery in the alarm system because it's low, so it's beeping when it doesn't need to beep. So we're gonna just change the battery pack here, and then hopefully you don't have the alarm beeping at you when it doesn't need to.
That's a good analogy. I like that. Becca wants to know, do sleep or lack of sleep or caffeine, too much caffeine, I say this as I'm drinking my coffee, can that trigger a panic attack or impact your vulnerability to getting one? Dr. Heckert?
Absolutely. So getting poor quality sleep or not enough sleep can make that amygdala hypersensitive. And also decrease activity in the prefrontal cortex, which is the brain's logic center. And normally the prefrontal cortex evaluates those threats or those alarms that the amygdala is sending and determines if they're real or not. So if that prefrontal cortex is not functioning properly, then those danger signals can escape even when there's not a real threat.
One more question for Dr. Sewell, and this is from Lisa. Lisa wants to know, are panic attacks ever dangerous?
They feel dangerous.
Yeah, they sure
but
do.
No, they're not. Okay. No, and like I said earlier, they end too. And so I think that as scary as those symptoms feel, once you've had that checked out by a medical provider and you know it is not something actually physically dangerous happening in your body, that's when we start jumping in with techniques and with approaches for actually treating it so that it doesn't have to continue to make you feel that way.
I want to wrap up this discussion with some final thoughts this morning. Dr. Heckert, what do you wish people watching knew most about panic attacks?
Well, I wish people knew how common they are, and that it doesn't mean that there's something wrong with you per se. A panic attack is your body reacting to some perceived threat and sounding the alarm. And sometimes it's just a little overactive. And there are lots of treatments available for panic attacks, everything from therapy to medication. So people shouldn't be afraid to reach out for help.
Who would they reach out to first?
Well, the primary care doctor is, a great place to start. Most primary care doctors would be comfortable referring them for therapy or even starting medications.
Dr. Sewell, what do you want people to take away from this?
So the techniques, and especially the exposure and response prevention therapy, is one of the most effective therapies we have in the entire field of psychology. So if people take away anything, I want them to take away that these are very manageable and in a really straightforward and time-limited way. It doesn't even take that long to treat panic attacks. So I hope they will reach out for help.
You're nodding your head vigorously. So how? No, I love that. So I was thinking panic attacks would be a lifelong battle, but it doesn't take. Like, how long would it take? I know every person is different.
Every person is different, but depending on, usually by like 4 to 6 sessions, it is significantly better.
Wow. Oh, that's so encouraging that you could, so 4 to 6 sessions. Dr. Hamilton, what would you like to really drive home to people watching?
So very treatable would be one thing. And then the other thing is I think there's sometimes judgment associated with having panic. And I like to tell people, your body's doing its job. It's sending an alarm to keep you safe. That's why anxiety is there. It's to keep us safe. and sometimes it does need to be recalibrated or the battery needs to be changed, but I'm glad it's doing its job. So let's not judge that it's doing its job. Let's just recalibrate it. Let's just change the battery.
Such a good way of looking at that. Thank you so much, doctors, for taking time to be here. This is a great discussion. Hope that you've benefited from this. And thank you to our viewers for joining the conversation with us this morning. Coming up tomorrow, we're just weeks away from the World Cup, and Kansas City will host a total of 6 matches. Prepare for the traffic because the Kansas City area can expect more than 600,000 visitors during the World Cup. We're going to dive into the healthcare plan for all of these extra guests and for you here in the community tomorrow at 8 a.m.